can sometimes feel like a lot, but you don't have to do it alone. I strongly believe that we're stronger together. Here, we're going to slow down, have real talks, make sense of things together, and explore ways to intentionally grow the life you want. We're going to talk about mental and physical health, relationships, money, work, and community. Welcome to Rooted in Intention with me, Karina Gomez.
Hi, everyone. Thank you for tuning in to another episode. Today, I'm joined by a special guest, Dr. Luis Chug, who is a sleep and pulmonary doctor and a mission-driven investor in residential assisted living. So, Dr. Chug, thank you for joining me today. So
Thank you,
excited.
Carolina, for the invitation. Very excited to be here.
Yeah. And I usually like starting off with people's stories, but I have a question before jumping into that. How is the doctor doing?
Oh, well, I'm doing good. Thank you. Things has been doing well for me. Appreciate it.
Wonderful. We have to check in on our doctors as well.
Yes. Yes, no, that's true. Especially nowadays, we know and recognize that there's a lot of burnout from not only doctors, but nurses and other healthcare providers.
I imagine, especially after COVID. So I actually have a public health background, worked with, I don't know if you're familiar with community health centers, but worked very closely with that. And burnout was definitely a big thing that I would say healthcare systems are trying to address. So
Is real and it has to be addressed not only of the healthcare providers but also for the patients.
because we're all interconnected and we influence each other. Okay, so with that, I would love to hear a little bit more about your story and what first got you interested in medicine, and how did you then become interested in investing in residential assisted living spaces as well?
Sure. So basically, I am originally from Peru. My family is from there, and that's the place where I grew up and finished my medical school. I got interested. My family has a background on medicine. My dad was a pediatrician and allergist, and my mom she is a nurse. And right there, I got interested. I always liked science, and I decided to help people. My training was challenging, but also very satisfying. And then I decided that US was a place for me to continue my training. My dad did some years of training here, and he always motivated me to come here. So I decided to apply and do all the testing and all the training that is required, interviews, etc. And I ended up in a residency in New York, which was a great experience. I did 3 years of internal medicine, and after that, I decided to follow also one of my passions, which was lung disease and ICU. So I did that in Kansas City for 3 years more, pulmonary critical care. And then, not satisfied on all this studying and training, I decided to do another year in Houston doing sleep medicine, which ties up very well with my specialty of pulmonary and critical care. So I am quadruple board certified on these specialties. And I have been in Houston for the last 10 years serving the community. And now, after COVID, and we can talk more, I'm pretty sure. Before that, I joined a practice and I was working for a hospital. And after COVID, there was a lot of burnout because I was covering ICU a lot. And I was just having my second baby, and my wife is a nurse too. But she unfortunately had to stop working at that time. And after COVID, I spoke with her and I told her that I was very burnout, something has to change, and we decided to open my own practice and become an entrepreneur because obviously being my own boss requires a different mindset shift. And I decided that I trained myself, I educated myself to also reinvent myself, to do other things bes beside medicine. And that's where my entrepreneurial journey started. And actually, it went well. So I'm very glad that we took that leap of faith. And now we are in a position where also I want to decide where to invest, not only my financially, but also my time. And one of my focus with my wife, a partner, a business partner, is to help our seniors. And one of my focus has been senior living now.
That's quite a story, especially because I imagine that there's so much difficulty in moving countries, plus the training around. You said you are quadruple board certified,
That's correct.
and then I would say on top of that, you made the pivot into entrepreneurship, and I imagine that was a big change. Can you share a little bit more of what that looked like at the beginning? What were some of the things that you really had to change about the way that you viewed things?
Something that I tell my colleagues when they hear my story is that we as doctors, we are trained to be very stoic, that we can do everything by ourselves. And one thing that is very hard is to try to change that ship where we can do everything and try to bring up that we can use help too. And try to get the right teams for the things that we don't know. And that mindset shift is what is important for being an entrepreneur, in addition to have an abundant mindset where you want to provide a service to people that need your service and try to find out what are the pain points of your customer. And from there, try to bring that service that you can provide,
Mhm.
and also try to help people in your own team to see how you can help them as well. I think that's the main mindset that I had to really change, and that's where I started. Besides starting my practice, I also invested in real estate, and I did a lot of seminars and masterminds that really helped me with that mindset. And I think that's the main shift that I did, and that really helped me not only with those, but also in my personal life, where I found myself that teaching or reinventing myself and changing my mindset could help also in my personal life, with my kids, with my wife, with my friends.
Mhm.
And I think like nowadays I'm really more proud sometimes from that mindset shift than my all my medical career. So things I'm achieving now, because reinventing at this age after going through all what I went through is not easy, and not only for me, for a lot of people in my position.
Yeah, I would say my mom, she's like, oh, like I'm too old to learn new things. And I'm just like very forgetful. But it's just recognizing the power that we do have to make those changes. And I think that's what I really appreciate about you saying is just like, oh, I actually had to do like more learning and change my mindset. And I was talking to someone that is a neuroscience coach. And that's one of the things that she was just saying as well is the neuroplasticity that we have within our brain. And I think it's a message that so many more people need to hear is that we can mold our mind and we can make pivots in life.
Yes, I'm glad that you mentioned that, because that's one of the things I try to work with my patients. That is exactly what how they talk to back to themselves. Like they cannot do it because they have been doing it for so many times. Oh, I've been smoking for so many years.
Mhm.
Oh, I have been eating this way for that many years. And that's exactly where I'm more successful, is to talk to them first that they can do it and change that chip, that is a matter of baby steps, but those small changes and the way you talk to yourself is very important to switch. Otherwise, we're not gonna, no matter what I do as a doctor, they are going to continue doing what is harming them. So I think that's very key on seeing my patients.
So for the patients that you see, do you see two different types of patients? One for sleep pulmonary issues and the other one for the residential assisted living?
Good question. So the good thing about my specialty is that it connects with different settings. I get to see the patients in the hospital when they're sick, the senior adults in the ICU, also on the floors and in my office. But I also go beyond that in my practice and see these patients in other settings like nursing homes and assisted livings. And I get to observe firsthand that continuity of their living, because most of our seniors they are going to require some sort of senior placement at some point on their life. I think that's the percentage, if I'm wrong, is more than 70% of seniors are going to require some sort of senior living requirements. And that's huge. That's why I promote my videos and my social media education on how to discuss these caregiver us as caregivers. If you have your mom, your dad, to discuss this situation earlier, because a lot of time what I see when I'm rounding around and in the ICU, that these conversations happen very late in the stage and when there is a real need, rather than be prepared earlier and have more time for the senior, the elderly or loved ones to uh, process the information.
And I know me and many others have parents that are aging. Can you share a little bit more of the things that you find helpful to have in those conversations with our aging parents? And what are some of the things that you see that work and some of the things that aren't as helpful and make the process harder?
Oh, sure. Thanks for bringing that up. And uh, again, I think like one is to try to discuss things earlier and bring those issues. Try to focus on the problem more than, oh, we have to talk about sending you to this place. It's better to bring the problem, like, for example, Mom, I have noticed that you're missing your medications, or how are you doing? Are you able to come down the stairs? I've been noticing that you have been falling more often. So focusing on the problem is a second recommendation. Another recommendation is if there is some sort of defensive, which is normal approach, is the sentiment from our loved one, we should instead of avoid it, try to recognize that there is going to be and something like, Mom, I see that you are distressed, you are sad, so I just wanted to let you know that I'm here for you to support you. And then maybe take a break, and if things get a little bit more challenging, try to bring some experts. For example, if there's too much tension, to bring a doctor or a social worker to kind of help with these conversations. The other thing is important, and that happened to me actually. I'll tell a story that sometimes it's good to bring the not other family members and recognize that you are, as a caregiver, you are that there is a burnout, because sometimes family members that are outside, they don't realize how much care and time our loved one requires. And once they realize, maybe we can have a family meeting and support each other. That happened to me with my dad. Like, I was finishing my training and he was unfortunately getting sick, and I was living with my sister and my mom. And I vividly remember that they They keep telling me the stories of what he's going through until I took a break. And one weekend I went there to help. And I remember I stayed with him. He had a heart condition, and I couldn't sleep. I was like
Mm,
helping all the time, even at night. And actually, I fell asleep at some point, and it was so hard for me to keep up.
mm,
And then I realized like how much work my mother and my sister were doing for him. So I think that's very important to also talk with the other family members so they are in the same page.
mm,
Because that's where I see a lot of drama. Fortunately, in
mhm.
the ICUs, when there is a fire, I mean, it's not the perfect time to discuss this situation. So yeah, those are some of the recommendations that I will give to people to do that, to how to approach this. I hope that
Yeah.
helps.
Yeah. Thank you for sharing about your experience with your dad. And I imagine that that was a lot for the family. And yeah, I think is one of those other parts where there could be a lot of burnout as well. And recognizing, especially if someone has health issues, I imagine that could last over years. That's someone that needs a lot of help and attention, and being able to, if there are siblings, hopefully, luckily that people have, or other family members, I imagine that it would be super helpful to what you were saying, being like, hey, like all of this can't fall on one person. And I'm curious if you can share a little bit more about the different options that people might not be aware of in caregiving for someone that needs support. And I imagine this might look a little bit different depending on like the states where people live, but what are some things for people to consider?
Sure. So obviously, it will depend on the level of care that a particular patient might need. And obviously, there are also the financial, obviously, aspect. But in general, depending again on those factors, you can have a home health or a visiting nurse at home to help. And you can have also an assisted living where assisted livings are a senior living where the caregivers they can help basic daily activities and they can help with medication, they can help with feeding, maybe mobilizing. Nothing more extends than that, no
Mhm.
medical care. Some doctors can come and nurses to help, obviously, but that's basically what assisted living. In between, also you have independent living, but that's less support from a caregiver. And these could be paid at some part from a private or sometimes insurance will not cover this for most of the time. That I have to say that medical insurance. Sometimes people that have insurance for senior living, I forgot the name, that can cover some of the costs, and there are some VA benefits that might help.
Mhm.
Then after that, you have obviously skilled nursing facility where the level of care is higher. And then obviously other, I think that those are the main ones. And I just want to mention that for those caregivers listening and that always is good to realize that not to feel guilty of making decisions because there is data actually that supports that assisted living or some sort of senior living actually has is more beneficial for the loved one because you don't have that social isolation. There
Mhm.
is better outcomes because you have a more of a 24-hour caregiving where they can support with activities and moving the patients. If because you can imagine sometimes patients can, and I've seen it a lot, can be incontinent and you need that constant change, otherwise they develop wounds.
Mhm.
Also, patients with dementia, they sometimes wander at
Mhm.
night and they need that special support 24/7 to redirect. Otherwise, it can be dangerous for them and for others. So there is research. My point is that actually senior living is has improved outcomes and more, not only hospitalizations and entering to ERs, but also improve quality of life. Obviously, you can see people interacting more with other people. So that social isolation is important to keep our loved ones more active.
I'm curious if you've thought about this. When you reach that older age, senior living something that you've considered for yourself, or what are your thoughts on what your life might look like when you're older?
Sure. Yes, and more that I have been into this space. My mind has been my goals has been to obviously try to support myself and have a financial cushion so that me and my wife we can like have that decision of choosing where we want to spend our days, right? And don't leave my kids with that tough decision. But at the same time, obviously, try to save so that we can have a comfortable retirement. And that might include to live in a senior care.
Yeah. I think what appeals to me about being in a, I don't know if it's a senior living or I haven't looked at all the retirement options, but is really the sense of community. And I think you were talking a little bit about what the research shows in terms of like reducing hospitalizations and having the support when there's health issues. But I think one of the pieces too is just having that sense of community. And it's something that I've talked about with my college friends is, wouldn't it just be nice for all of us to buy like one big plot of land, and we all still have our own separate houses because we still appreciate like our privacy and our own space, but still knowing that we're close to each other and creating that sense of community. And I imagine that that's one of the things that's helpful because in the US, not only is there's like the loneliness epidemic that we have, but then there's the like additional loneliness when someone might be growing old and their kids might be off like in a different state or in a different area and they're not having as much of that like human interaction. So yeah, interesting things, I guess, to think about for both our parents that are growing older and for ourselves as well of what is the society that we're creating and in what direction are we going and where's community left with all of that?
Yeah, and I think that's a good question to start asking ourselves. I think in US we don't ask that. We think like, oh, we'll sort it out later on, or our social security will help us, and actually will not because it's not going to cover senior living. The sense of community is very important, and I think that's one of the attractive part of senior living, like assisted living. And we see that a lot more in Europe. I've seen that people takes that more into consideration than here, but definitely very important. And just to going back to your questions, when I started entertaining this idea was a few years ago before I started looking to senior living. I remember a patient that he was very young, actually. No, I mean, he was probably on his late 50s, but he was by himself and he was telling me he was pretty healthy, but he told me already like he told me that he already put money down for to live in an independent community. I was like,
Huh.
wow, but you're so independent. But he brought that to my attention, like actually there's not a lot of places and he's by himself. Like if something happens, he would like something secure. And it did make sense to start thinking, made me think more about that option.
Yeah. That is interesting because it kind of reminds me of one of my friends. This was in high school, but she was telling me that her mom already purchased her like grave or her like space for her body. And I was just like, what? And I was just like, people are thinking so ahead of that. And then later on, I ended up learning that they're actually very expensive. So there's, I guess, plans that come up where people could pay over the course of years. And then, so by the time that someone does die, it doesn't fall back on the family to pay for that. And I was just like, that's so, how would I say,
And just
productive, like really thinking ahead. But I was just like, I don't know. It's interesting. But I
yeah,
mean,
especially I'm Hispanic too, so you don't get to in our culture you don't get to think about those things. I guess like more on the Caucasian culture that's probably more common, but
oh
uh,
no, they Hispanic, her
oh
mom.
really?
Yeah.
Kudos for
Um,
them.
but anyways, I imagine that you have a lot of conversations with patients as well, and you see a lot of the things that come up in elderly age. And I think prevention is like one of the top tools that we have as humans. And I'm curious, from things that you see come up that people end up needing help with, what are some tips that you might have for people to help, I guess, like age like fine wine and reduce some of the things that come up in what you see?
Sure. What a great question. And it's one of those questions that, as I personally have aged, I also been researching more and trying to educate myself. But not only that, I get to see a lot of healthy older adults in my job. And I always ask them, like, what do you do to be so healthy at this age, right? 70, 80s, I seem like minimal chronic conditions, great quality of life, walking, enjoying the things that they like to do, enjoying family time, not with oxygen or not able to even like do one step, but actually participating on activities. And what I have on my personal research, what I found on those patients is mobility, exercise. They walk 4, 6 miles, 8 miles every day. That's the number one thing that I notice a lot of my healthy patients. And they're patients because they get to have a little bit of allergies or things like that. So it's
Mhm.
not like my more sick patients. So yes, mobility, and we see it a lot also in my practice. Like those patients that don't move, and they get in the ICU, and one day that my elderly patients don't move, actually it's like 7 days
Wow.
that they get deconditioned,
Mhm.
meaning like just every day that passes and they don't move is like a lot for them to get deconditioned, get back to their baseline. So
Mm.
that's one of the number one priorities for in the critical care world is to and pulmonary to get them out of the bed as soon as possible.
Mm.
Sometimes it's not possible, but that's the goal. And other than that, I think like the regular recommendations, which is have a healthy diet, kind of like my favorite is a Mediterranean diet. Sleep well is very important. As a sleep doctor, we know all the benefits from sleep, and you name it. Improve, especially in the elderly, improve memory, improve cognitive function, decrease fall risk, decrease diabetes, high blood pressure. So sleep is very important, not only in the elderly, in all ages,
Mhm.
and different quantities for different people. Yes, for different ages. Adults usually 7 to 9 hours.
Mm.
Seniors usually around 6 to 7, and obviously for kids is longer, more than that. Yeah. So basically, I think those are the main recommendations.
Okay. Thank you, Dr. Chuck.
You're welcome.
And speaking of sleep, what does the research show are some key things to consider for your own sleep hygiene and I guess like sleep best practices?
Sure. Yeah, great question. So we know that by science that sleep before centuries before we thought like, oh, sleep is just a passive time where we just turn off and nothing is going on during sleep. And actually, in the recent centuries, we started to know that sleep is very important for our health.
Mm.
We pass long time of our life also sleeping, and actually sleep is very important, like I mentioned, for your memory, is where your metabolism regulates our blood pressure, or our blood sugar comes down. It's like recharging our batteries. It's good for our immune system. We have studies that have shown, for example, that people that are sleep deprived and they get vaccinated, and people that they sleep regular hours, those that receive a vaccine during regular hours of sleep, they get a better immune response. Um, we know there's less accidents and more accidents actually on people that are sleep deprived. That's why we know that we have to start recommending that, for example, residents or interns or doctors, there's a maximum of hour shifts that they work. Otherwise, there's more accidents. Same like driving. If you are sleep deprived, I have seen there's a paper I think that showed that it's like drinking alcohol. So yeah, for those reasons and more, not only is important the time of sleep, but also the quality of sleep. Sometimes people they have some conditions or sleep problems that can predispose you to have a poor sleep quality. For example, sleep apnea, where you sleep, but your respiration is limited due to a narrowing of your throat, and that causes you to arouse very frequently and don't sleep well, and that can predispose to diabetes, high blood pressure, strokes, heart problems, etc. And so one of the recommendations, if you try to sleep and you're having bad sleep and you try everything, obviously sleep hygiene is very important, and we can talk about that. But if you still have issues, don't just blame it of that's how I am, or all my life I had poor sleep. Try to talk with your doctors, and also for maybe to get you referred to a sleep doctor, because you might have a sleep condition that you are not aware. And for the sleep hygiene, I'm sorry, I forgot that question. So obviously, sleep hygiene is very important, and mostly is obviously we know that light is very important to keep us awake, and also less light is important to regulate our internal clock, our circadian rhythm. So basically, get you exposed to a lot of light during the morning, very important, and decrease that light exposure at night, especially with now that we are with our cell phones and TVs and all that. We have to minimize that, especially in kids. In kids, I see a lot of, unfortunately, parents that they give cell phones. No, nothing wrong to give cell phones, but at night, there's no need to have our kids having cell phones at 9 o'clock, 10 o'clock, and that should be taken away from them. That's my recommendation, at least. That's what I do. I don't give cell phones to my kids. So light exposure early in the morning, decrease caffeine. If you're having sleep problems, definitely you have to cut down, because even though you drink all your life, your metabolism changes, and we cannot. The metabolism of coffee, for example, it varies and it's not very predictable. And also other best practices, naps, to try to limit those. If you need to take a nap, take it less than 30 minutes.
I thought you were going to encourage people to take naps. I was like, I love naps.
I mean, if you have to take it, nothing wrong, but try to limit those less than 30 minutes and not too close to bed, because when it's too close to bed, it causes a vicious circle, because your sleep drive is going to decrease and you're not going to sleep until 1 or 2 or 3 o'clock in the morning, and then wake up early because of your social duties, responsibilities, and then you're going to take more naps. And also, if you need to take naps, maybe there is a reason why. So again, talk to your doctors if you are you're tired or sleepy during the day. And yeah, cool temperature at night, and not too cold, not too hot, and try to minimize the light.
The Goldilocks amount. I love it. Going back a little bit to the maybe not getting restful sleep if you're waking up tired. And I know people should talk to their doctors about that, but what are some things that could potentially be getting in the way of someone having good quality sleep?
Sure, there could be many reasons, from insomnia where people have difficulty to initiate sleep usually. That could be many reasons: stress, health issues, menopause, psychiatric issues. So definitely that's number one. Another, like I mentioned, sleep apnea, very frequent, very prevalent, especially high risk on obese patients, but not, you don't necessarily have to be obese to have this. So we have several conditions that can cause that. So insomnia, sleep apnea, restless leg syndrome, narcolepsy, less frequent, but possible. And health issues. Some people have health issues like heart failure, COPD that can cause them have problems at night to sleep.
I'm curious, does snoring impact sleep quality?
Actually, snoring is a symptom of something going on, possibly. 70% of people, or close to 70%, they might have some degree of sleep apnea. So it's very important if you do snore to maybe get you screened first, because sleep apnea can actually impact your health.
Interesting, because I feel like a lot of my family members tend to snore on the male side. I don't know if is it a common gendered thing?
Not really. Most likely they have some degree of sleep apnea and they need to get checked.
Okay, so maybe it runs in the family.
Yeah, and it's usually the case. Funny story, I diagnosed sleep apnea not only in my side of my family to all my family, but also my wife's family. So
Oh, okay.
it's
So
very prevalent, it's very common.
yeah. And okay. So you obviously wear multiple hats. What advice would you give to people from someone that wears multiple hats?
I think the most important advice is not to be afraid to pivot and always why you're doing things. And if there's going to be always problems, barriers, people that will tell you not to do this and disappoint you, but as long as you know why you're doing things, and that really clears the path and makes things a little bit more like easier.
Thank you for sharing that. Dr. Chug, I know you are in the digital social media space. How can folks connect with you?
You can follow me on my Instagram, Facebook, LinkedIn, and also I have Facebook group for healthcare workers investing on assisted living. If you want to have more education about this investment and with purpose, please go ahead.
Okay, and all of those details will be included in the show notes. Thank you, everyone, for tuning in. If you liked today's episode, go ahead and leave a review and let us know what you thought. Okay, bye.
Thank you for joining me for another episode of Rooted in Intention. Until next time, and remember to keep showing up for the life, relationships, and community you want. Now go, grow the life you want